I will, without further ado, hand over to Soorej. We're going to be having a session this morning where we're looking at different kinds of reviews to be done in our research to help us understand existing evidence, to assist in identifying evidence gaps. And Surej has kindly agreed to give us an overview of that process. And we're very fortunate. Surej has been involved in running and coordinating various reviews at different levels. So, Surej, huge thanks, and I'll hand over to you.
Thank you very much, Joe. Um, I'm happy that you're able to log in so early despite the traffic. I'm just kidding. Usually there's always the excuse of people having traffic troubles with coming a bit later. But I'm happy to be here. I am gonna switch on my video. Those of you can please switch on. If not, it's also fine. Absolutely no issue. Um, as Joe said, the idea is to discuss a bit about scoping reviews. How I'll do is that I will actually try to explain some of the common review formats like literature review, scoping reviews, and systematic reviews. Through that, I hope I can distinguish between all the three, but also discuss a bit more on scoping review, and then quickly take you through some few steps of scoping review. And this is not supposed to be an all comprehensive review of lecture on scoping review. Just to give an idea, just to give a head start, and I'll give you some links and references which you can take a look and see what more can be learned on this particular topic. As Joe said, have done scoping reviews and systematic reviews in various capacities. So I've done scoping review with the intention of publishing it as an article, which we published a few years ago. So just like how you write an academic article with the introduction, the methodology, and all those kind of things. But then also I've done various forms of scoping reviews for WHO and IAM and so on. So there, the publishing part is a bit less evident, rather because they are more interested in the results and writing reports based on it. So then I have not published it as a typical article type of scoping review, but the methodology remains the same. And then the scrutiny you get is also a bit different. And if you appraise or not appraise, that's also another. And I'll take you through a few of those steps. I think Joe said during day one, and I'm repeating that, I have a tendency to speak fast, and I do speak fast, especially I don't see people's face. And with my wonderful accent, sometimes it might be a bit difficult for you to catch what I'm saying. So please stop me, ask me to repeat, ask me to speak slowly, because I'm here to discuss with you guys. And if you're not able to capture what I'm saying, both your time and my time will be a waste. So please stop me and ask me to repeat or take it slowly. I will share the slides. It is in much actually. Okay. Are you guys able to see in full screen? If so, thumbs up or somebody say yes or no, anything of that
Yeah,
sort
yes,
would
we
be great.
can.
Yeah,
Thanks.
great. Thank you. And I'm also not gonna see the chat. So if there is somebody who want to ask a question, just ask me. Just unmute yourself and ask. Um, so what I will, as I said, we will talk about scoping review, and I will try to talk about what is and what is not a scoping review, because that there seems to be a confusion and people use terms interchangeably, which is not right, because each and everything has a different methodology and a different purpose and a different intended outcome. So I'll try to do that part. Okay, this sounds simple. Probably it is simple, but I just want to know, first of all, what is your understanding of what is a review? So let's start with the first question. What is a review, literature review? If anybody can voluntarily start, I'm more than happy with it. And I have also no issue in sort of asking, because I see your wonderful names. I can also ask one of you calling by name. But if anybody wants to give a head start and just say what's your, and again, this is not about being right or wrong. Just want to know where you are, what's your understanding, and what we can build on it. Yes, Melissa, please.
Okay, hi everyone. Um, from my understanding, a literature review is a summary of different, I'd say, scholarly articles on a specific topic. So if, for example, you are researching on migration and maybe HIV, it's basically you putting all the relevant sources together and actually summarizing and linking them to how they are all arguing around that topic. Yes.
Great. I'm picking up on two words you said, Melissa, summary, and you also said a review of scholarly articles. Um, what is a summary according to you? Let's say if you're actually reviewing, let's say 50 articles, what would an ideal summary look like? What would you write there? Any hypothetical scenario. Because summaries can look different. Right? It can be like half a page, it can be 15 pages, it can be tables, it can be pie charts. What would a summary look like? What might you be looking into that?
Okay, so I might be looking at the different it'll be very hard for me to comment on the actual number, but I would say
No, it doesn't have the
the,
number, but I just want to know like in your
the
head, because when you write an abstract in an article, that is a summary. When you read a conclusion, that is also a summary. When
Mhm.
you read a report, sometimes one page is a summary, 3 pages is a summary, because it can look different depending on what you look at. So when you do a review, what should an ideal summary should contain? Should it look like?
um I don't know, an introduction and different similarities and differences across the articles that you'll be reviewing, putting
So the
them into
merits. So
section,
you're talking about how good or bad the articles might be. Is that what you mean by merit?
not how good or bad, but I would
Mhm.
say the different arguments that are coming from those
Okay.
articles. For example, someone might say, BB HIV is caused by, for example, just an example, by a
Yeah.
hot weather. And then someone
Yeah.
might say, oh, HIV
Yeah.
is actually caused by um, eating a lot of sugary things.
Right.
So it's actually highlighting how different scholars
Mhm.
are arguing
Okay.
around that
Perfect.
particular topic. Yeah.
So would you also then try to interpret between the results? As you said, the example you said, HIV is caused by hot weather, HIV is caused by
Mm-mm-mm.
something else, right? So then would you also put your interpretation to the result saying that this is more valid, this is less valid, or you just say this is what it is and there is discrepancy? Well, how would you
Yes,
classify
and then
them?
I think sorry, after doing that, then you take your stand on where you stand
Okay.
when it comes to those two or more different arguments on the topic. And then if, for example, if it's a master's degree or if it's a PhD degree, then you also back your standing with
Right.
evidence that you found in the field.
Regardless of the level of study, you always need to back
Hmm.
your findings,
Hmm.
regardless of master or
Yes.
PhD.
Yes.
But okay, so so you said that, so then you will also add your interpretation, right? But
Yes.
then is that a literature review as a summary, or is that trying to make a point from your side using evidence? See, there are two things. Let's say you're doing a typical primary data collection article, you collect the data, you analyze the data, you get the results, and then discussion, you're discussing parts of the results, what do you want to highlight? And then you make your arguments because of blah, blah, blah. The example you
Mhm.
gave before HIV, and you simply say that this X number of articles says it's related to weather related phenomenon or something else, and Y number of articles say something else, and Z number of articles, things like that. So would you then conclude by saying that there is a discrepancy and majority tends to believe this and that? But when you add to say that there seems to be less truth or more truth, then you're adding
Mhm.
your interpretation to that. Is that a
Yes.
literature review, or is that an article you author based on the data you have? Because the
Uh,
second one you said was that this is a summary of scholarly articles, right? So if this comes from scholarly articles, it could be equally true, right? Both sides.
um, okay, maybe not scholarly. I mean, literary review is not only based on scholarly.
Okay.
articles. Yes. So I was hoping to put that in quotes, like,
Yeah.
yeah. Yes. Yeah.
Okay, I'm not trying to put you on spot, but just to keep in mind, keep this in mind. We'll revisit this question back.
Mm-hmm.
What should a literature review note say? Should we just state what it is? Because let's say we say that there are 10 black cows and 5 white cows, and we can say the majority of the cows are black. Done. That's not interpretation. But when you go about saying that it seems that this particular farming community seems to have a more preference of black cows, that's an
Mm-hmm.
interpretation which you don't have evidence to support. Because
Mm-hmm.
you haven't interviewed farmers, right? You don't know anything. You
Mm-hmm.
just see this is what it is. So
Mm-hmm.
I would say literature reviews should be staying where what literature says. But it based on that, if you want to design a project or something later on, then you can say this is the phenomenon. It'll be interesting to understand why there are more black cows. Or it'll be interesting to understand why people say, in HIV's case, we know that's not because of weather, but
Mm-hmm.
take any other case, right? So maybe literature should be close to literature where which is a bit of a difference from if you're writing a primary article and you have one data set you analyze and you want to discuss it further. Here you want to discuss the lay of the land, the lay of the literature, not much
Mm-hmm.
more than that, so to say. Now, the
Okay.
second word you said,
Thank you.
scholarly articles, and you said you want to put it in inverted commas. Why?
Um, I think, and this is one of the arguments that we were having with some of the colleagues, I think a few months back, that during the WDA, that when you go to varsity and you're asked to write something, it always has to be something like scholarly. You often discourage to references sources such as maybe news broadcastings, magazines, and so forth, maybe because of the level of or the process of validation when it comes to such information. So, which is an argument that we're having, well, not an argument, but a discussion that we're having, that now when you reach this level, for you to actually start citing such sources becomes very difficult, because already
Mm,
you are cemented in the idea that whatever that you write, it needs to be from Google Scholar, Web of Science, Scopus,
right,
and it
right.
needs to be a scholarly article. Yeah.
So when you say scholarly articles, am I right to interpret, are you referring to peer-reviewed articles?
Yes.
All right,
Yes.
okay.
Even with book
So,
chapters, it's always maybe stay away from, don't reference much book chapters, or
uh,
like a book
why?
on its own.
Why?
Um, I don't know. I think I'm not sure if others can share the same sentiment, but I think it was just from the research topic. I mean, from the research module that we were taught, it has always been, you can't afford to read the whole book and then actually reference it, but it's easier to read an article which is like 10 to 15 pages. So that is more um assuring, if I could put it that way.
That's different, right?
Mm-hmm.
One is actually chapters in a book. So let's say you have a 150-page book and there are like 10 chapters, and each chapter might be 15 pages long on a particular
Mm-hmm.
topic. So would it be in that case? Because the example you gave now, the reason you gave was it's too much to read and to refer. If I'm removing that, saying that you only have a chapter to read from a book, would that then be okay to add as a scholarly article?
Yes.
So it's just the number of pages that matters, huh?
Well, I guess I
Yeah.
don't know.
Yeah. So the thing here is that you need to look into what is being said, how it is being said. Somehow we have the idea, which is more or less true, but not completely though, where peer-reviewed articles, we have a rigorous peer review process.
Mm-hmm.
A book chapter also has maybe not at the same level. If it's depending on how the book is being done, right? When you have edited volumes, it might be just two editors reading 10 chapters. Whereas in a typical article, it's gone out in the free space asking for reviewers. I'm sure you might also been asked to review articles. Independent reviewers come and review these things. So there is also this the way it is been, because in an article you have the introduction, you have the methodology, and so on and so on. A chapter is often not that. It's discussing a topic in different ways. And then is that a finding on its own, or is it just the author's idea of topic XYZ? This goes to a decision we had before. The literature says that HIV is caused by hot weather and something else. So that's the point we need to think. And this also key part you can keep in mind. Depending on the type of reviews you do, you may or may not be able to include other forms of peer-reviewed articles or non-peer-reviewed articles, right?
Mm-hmm.
And it also becomes tricky when you're researching a new topic, let's say let's say 10 years ago, we're going to have a review on climate-induced migration. Much hasn't been written on it, and let alone peer-reviewed articles, and you're doing a review. And if you're going to put your limits on peer-reviewed articles, you're probably not going to get much. But on the other hand, IOM, WHO, a lot of others have written on it. Are they scholarly articles or not? Or let's say the Ministry of Health has done an investigation, a formal investigation. Is that a scholarly material? Can we include that in review or not? Just because it's published in Lancet, I can honestly say that I've read several articles in Nature, in Lancet, which is absolutely valuable, nothing. The methodology is fake, and also we have this blind trust on peer-reviewed system. That's another topic. But just keep your eyes and mind open. Sorry for taking your time, but it was an interesting discussion. Once more, I saw your hand up and then down.
Yeah, because I think you touched on something I was going to comment on. It's covered already. Thank you.
All right, good. Anyone other than Melissa, and once more, why do we need to do a review?
Maybe I can jump on that question since I did not contribute in the previous one. So I mean, I think if I had the question correctly, you said why do we need peer review, right?
Yeah, the second question, why do you need to review? Why need to
why do
why
we
need to do a review?
Because I think or primarily because we are not writing general text. That doesn't make sense. We are writing within scientific context or research context in which we are trying to build certain already existing arguments or certain already existing research or findings, and we try to continue with the discussions that already exist. I think we had a conversation in Joe's presentation, is it a day before, I don't remember, that we have some kind of a responsibility to recognize what has already been done, and so carry on building those existing knowledges so that we can have, continue building. I think that's what I can say. And therefore the kind of the reviews, I think, just to add on what you had the conversation with Melissa, then have to be very contextual, I think, at least unless you are referring to a historical issue that you want to bring to current conversations. But if really you're talking about the current existing issues, then it is necessary to talk to existing literature in the very latest writings. And therefore, sometimes I've heard the argument that books then become a challenge to refer to, especially because most of them are old or have been written a while ago. So yeah, that's what I can contribute for now.
So just to get the lay of the land in terms of the topic you're looking at, and also understand what is the latest evidence or discussion on it, if I understand you correctly.
Yes.
Okay, great. Tanatwa.
Thank you, Soorej. Very interesting conversation. I'll contribute in the sense that when we are writing, we are having a conversation, and that conversation is situated within discourse where you have your audience. So to be able to contribute to a conversation when you are writing, you need to be able to know what has been what has been written, what is left, and what kind of or manner of conversations have been happening, so that you know where to place your contribution. And in the same way, you are also writing to present an argument, which is where you are trying to influence others through reasoned discourse, so that they can believe what you want. So the crafting of that argument has to have credibility, which comes from understanding also in part the values and beliefs and principles of the audience that you're engaging. So to be able to put all those things together, your conversation should be informed by listening to others. So for me, I consider a review as a way of listening to others so that you can make an intelligent contribution to the conversation. Thank you.
Right, great. Where during a research process when, in the phase nature of it, would you ideally do a review?
Is this for me or it's for the floor?
Yeah, you can start. Go ahead, Tanaso. When in the research process would you do and review?
I would say throughout the whole research process, once you, for example, in terms of crafting your own thinking, writing is anyway a process of thinking. But so for me, the review until you are done, you continue to make your argument. You continue making that contribution, but it depends with the depth at which stage of the research. So before you write, when you're thinking of your ideas, you continue that conversation.
Right.
Yeah.
Right. So you're right. We should do it throughout the research process, but for various purposes. So in the beginning, it will be to get an understanding of the topic, and maybe you're thinking about a question and see like, okay, has this already been answered or not answered? What is the gap? What is not the gap? So that's sort of the initial phase. And then when you actually do the research and when you start to get some sort of results and you actually want to see like how similar or not similar this is with the existing evidence. So you want to further explore and compare your results with the existing literature. There you do another kind of literature review. In some case, you already want to do another kind of review, which actually is this intervention going to work or not? It's rather a close-ended question. You can also do review for those purposes as well. So you do, of course, do across the research process, various research stages, but with various intentions, various purpose in that. I saw Stanley and then Nireshni. Stanley, or did I already answer your question or comment?
Yes, you did answer my comment, but just to add, I wanted to just say, according to my understanding, literature review is like we conduct it just to try to find out what actually other scholar or other writer have said about our topic of interest. And yes, we can conduct literature review throughout the research project, but it is ideal that we conduct literature review before we can do our data gathering, maybe just to have an argument, and then we can continue doing literature review after we have done with our data based on the themes that we have developed from our data. And then we find something interesting that maybe we did not include on our literature review, and then we go back to our literature review trying to refine, trying to find out if there's something similar that has been done based on our findings maybe. And it cannot be only academics, because on the literature review we can also involve reports, involved governments, gazettes, involved op-ed sometimes, Yes, I think that's all from me.
Great. I'll get back to on the topics of which types of articles you can include and you shouldn't. Somehow when you guys talk of literature, I have a sense that you're talking literature as a document, which you go back and update and so on. Yes, it could be the case, but also take the meaning of the word for what it is. It's a literature review. So let's say that I'm doing a project, and you did my literature review, refined my question, did the data collection and so on and so on. And then I have the discussion of the results, right? I just want to know more what is done based on my particular results. I can do literature. I don't need to write a report just for the second part of the review. It just improves my understanding of what is being done and what my findings add to it. And also, somehow you also mentioned that it's a way to justify our research question, our approach. Yes, it is, but also it's a way for us to be more knowledgeable and say, okay, these questions were asked, for example, HIV, and we are talking about PrEP. Yeah, now we want to look into how gender differences can influence the access of PrEP. Maybe there's already a lot of literature on just access to PrEP. And for example, how does being transgender or non-binary impact the access to PrEP? So you are actually narrowing down on it. So it's not about argument, but also to further refine and know more about a particular topic. But all good. I saw Nireshni, if I say the name correctly. Not sorry.
Yes, you are saying it correctly. Thanks. I think I mostly covered. What I was going to say was that usually we do literature reviews to guide our research questions, to guide the methodology, and to identify gaps and to see where we can use our research to fill in those gaps.
Perfect. Great. Thank you, Nareshni. So this is, I'm trying to give you a picture of the differences and similarities between some of the common review forms. There are many other. I'm not going to go through all of it, but these are sort of the three common ones we are using quite often. So it's the literature review, which is also sometimes known as the narrative review or the desk review. Basically, it's a quick and dirty method. It's not much systematic. So, and then you have the scoping review, which we'll try to discuss a bit more. As the word suggests, you're actually scoping out the literature that is there on a particular topic. Systematic review is much more rigor, and often you ask a specific question to it. And we can look at the difference for these three forms based on few of the attributes. When it is used, or why it is used, literature is just, I'm curious about this. I just want to know what's happening. Migration and health, or gender and migration, or labor migration and disease. So those kind of general questions, right? So, and you're not necessarily going to assess the extent of the literature. You just want to know the topic, and you probably just pick what comes up first. I'm sure most of you will start by using Google Scholar, type the keywords and take the first 10, 50 hits and have a look at it and done. And that's fine. That gives a general overview, but then understand it's Google who ranks what comes first. It might be based on citation. It might be based on a lot of other things. It is based on how this algorithm for Google Scholar runs, but it gives a general overview. Whereas scoping review, you actually are going to assess the extent of the literature that is available. And there you have to be a bit more systematic because you are trying to cover as much as possible the entire corpus of literature that is available on that topic. And then how far you'll do it, it based on the search criteria, inclusion, exclusion criteria, and so on and so on. But you tend to cover a much larger body of literature, and it's more systematic. Systematic, the idea is that when you have quite a lot of literature published on a particular topic, and then you want to ask a specific question, let's say there is quite a lot of literature on HIV and gender, and then you want to specifically ask the question about how does transgender people access HIV-related support during the initial phase of the disease and during the latter phase of disease. That's too specific because there is already quite a lot of literature is being published. And often that knowledge that a lot of literature is published, you get that from a scoping review done before. Scoping review, you does in that part where you know that you're not sure how much is published, but you're aware that quite a lot is published, but let me take a look into what is there. So I repeat once again, literature review in the beginning, just to know what is happening, and you probably use Google or something else just to get an idea, and you just pick first 10, 15 articles and get an understanding about it. Scoping review, you actually want to know what is actually being covered in the larger body of literature, and you try to be as systematic as possible. Systematic review, much more rigorous, and you want to know specific questions on specific topics. That's sort of the difference in when and why it is used. The research question, as I said before, I think I covered that when I discussed the previous topic. It's more specific. As I said before, the question would be, in case systematic review, is MUAC. MUAC is the mid-upper arm circumference. This is I don't know how many of you know it. I think the ones who are working with nutrition should know it. It's sort of a tape you put on the upper arm circumference just to see how malnourished the child is or not. So a typical systematic review question could be, how effective is MUAC in identifying malnourished children during drought in Amhara region in Ethiopia or in Sub-Saharan Africa? That's too specific. I'm looking at MUAC and I'm looking at a particular kind of starvation. It's the drought period. Starvation can happen due to war, a lot of other things as well, right? And in a particular region. I'm giving the example because I've had colleagues who done their research on it and found that actually the cutoff values used by MUAC is not actually a clear indicator. We need to have other methods. So that's a typical systematic review question. Scoping review could be general understanding, or how is MUAC used and how far is MUAC used, or how is MUAC used to assess the malnutrition levels. That's a broader question, and then you get the literature on it. So you see the difference between the questions, right? The search protocol, by protocol I mean you have, okay, This is my question. These are the database I'm going to choose. This is my search string. These are my inclusion exclusion criteria, which includes the keywords, the year of publication, the language, type of studies. Should I take reviews and review them? Should I take cross-section studies? Should I take longitudinal studies? Should I only take qualitative studies? So all these are protocols. Literature reviews usually don't. As I said, it's pretty much Googling in the sense I can say. You get it and then you write up a summary and then move on. Scoping reviews, I would strongly recommend everybody to have it, but there are also scoping reviews who doesn't have it, but they should have a protocol. But it's a bit looser than the systematic review protocols. I'll give an example later on. So scoping and systematic reviews usually have research search protocols, and systematic reviews are a bit more tightened. The idea is to get the best quality literature and to prevent any sort of randomness or by chance occurrences. So it has to be more specific. Comprehensiveness, as I said before, literature review, it's not so much, it's just a quick idea of it. Scope and review, here we are looking into breadth, capturing the most number of relevant literature on the topic. But systematic review, it's not the breadth, rather the depth we are looking into. I have a particular question in this broad topic and I want to answer that. There it is comprehensive. So it's narrow, but it's comprehensive within that. Whereas scoping review, it's quite broad, but it's not narrow enough. Inclusion criteria, as I said before, for literature review, there is often not much. Scoping review, it is. And this is a place where you actually use gray literature more often. Are you familiar with what is gray literature? Anyone?
Can I
Things
answer?
like news articles.
Pardon me?
Things like news articles, maybe those that are not necessarily peer reviewed.
Okay. Anyone else?
No, I was gonna say the same. It's mostly unreviewed articles like your news articles and so on.
Right. I would necessarily put that way. I think news articles, I would never include in any sort of review, to be honest, unless it's a discourse analysis of how, for example, racism is being described in the South African media. Then you include that, but then that becomes your data, not a review material. So I would never use news articles in reviews. So here, Chavi, maybe you have the answer.
Yeah, I can read that it mostly include like government policy papers and
Right.
something like sources from government agencies.
Right. Great. So exactly. So materials like government investigations, government reports, or WHO reports, or UNHCR reports, all these are reviewed, but not reviewed in terms same as we do for a scientific article published in a journal, right? These are reviewed, but it's a different kind of review process. So these are gray literature. So I would never recommend adding anything which is not reviewed at all. So gray literature are also reviewed, but not like a typical peer-reviewed scientific articles. So for example, the global reports we publish for WHO, they are reviewed, but they're not peer-reviewed articles, but they are gray literature. So you count that. And the reason I said non-scientific, for example, I have a PhD student now. She is looking into how health promotion messages are being understood and acted upon by migrants in Germany. And for that, she's first doing a policy analysis. And for that, she's actually doing a scope and review of all policy documents. So what she does is she actually contacts each and every government agencies in Bavarian region of Germany and the federal governments and asks them by mail and by phone to get these documents. So that scope and review allows that. Systematic reviews often doesn't do that. They could, but often they don't do that. But it's more strictly defined. Scoping review, it's a systematic search, but it gives you more freedom and can include more literature. Systematic review, it's a bit more narrow and more clearly defined. Data extraction, I will show a table later on. Literature, again, nothing standard. You just read the article and you write your understanding about it. Both scoping and systematic review, it's standardized. Like in other attributes we discussed, in systematic review, it's a bit more standardized. And I'll show an example later on. Data extraction is basically the process of you read an article and you take the data that you need. So it might be the year of publication, the keywords, the main outcomes. Is it an odds ratio for smoking? Is it mortality? Is it morbidity? So you have an Excel table, for example, extracting all the data you need or the key results of these things. So that's what I mean by data extraction, and it's often, not often, it is always standardized for scoping review and systematic review. I'll have 3 or 4 more attributes. Any questions so far? All right. So appraisal of included documents, and I think this is what I was referring to when I was talking to Melissa. So should we just include all the documents we get, or should we try to assess the quality of the articles we are including? So there are various tools looking into how good a quantitative study, are they actually, for example, typically when you do a cross-section study, I don't know how familiar you are with it. Cross-section study is basically you're doing a survey at a given point in time, and you're getting results saying that right now the prevalence of disease X, Y, Z, this blah blah blah, and it's mainly impacted. It mainly impacts women, and then it is what it is, and that what's the cross-section study. But I've seen several studies saying that there is an association between, or the gender seems to have an influence on disease Y, Z. You try to assume a causality. For example, a cross-sectional study can never assume causality, because for that you need to have a longitudinal cohort study. This is an example. So if you have a study that says this kind of false statement, it's of poor quality. And this is a generic statement, right? But you have several quality assessment tools for qualitative, for quantitative, for case studies, and so on, which you can use. And then, depending on how you do the study, some people actually say that I'm using this and this tool to assess the quality of the studies. And if it doesn't meet the cutoff criteria, I'm not going to include those articles in my study. Whereas others would say that I'm going to include all the articles which I get in the literature review, but I'm going to have a separate comment on which articles were of high quality, low quality. So in literature review, you do not do any such kind of approach. You just take what it is. In scoping review, ideally, I mean, traditionally you don't do it, but it is recommended that you also do it. In systematic review, you have to do it. Then use, I think we discussed that in our earlier discussion, where to use these kind of reviews. Literature review, introduction to an article, you want to discuss. Scoping review, prior, during, start of the project. And systematic review when you have a particular question. Ideally, like in many of my projects, we use a systematic review to see how to best design a particular intervention for a particular disease or a condition. It's too specific. Then this is the golden thing, right? In medicine, from a medical point of view, as long as you're not able to replicate what you have done, it's of poor quality, because then the subjectiveness comes into play. The reason why systematic review has so many different criteria and so strictly defined, saying that if I use the same search strategy with the same inclusion and exclusion criteria, I should end up with the same number of articles included as person X, Y, Z. Then it's not random. It's not by chance, because I have a strict protocol, then it is science. Yes, that is true. But just to note that there can also be difference in how we use different databases and how we access and so on. But the ability to replicate is much higher for systematic review. So by chance occurrence is reduced, and bias is also reduced. In scoping review to a great extent, but not always. Like the example I gave of my PhD student, when she interacts with the ministers or the authorities, the kind of document she might get 10 documents now, but maybe she asks tomorrow to another person, she might get 11 documents. So there is this replication issue in scoping review, but it's still much more reliable than a literature review. And then what it produces in the end, literature is a general discussion we discussed before. Scoping review, it basically says, so for example, we did this review in 2019 about migration literature published on migration health in Ireland. So what we did was that we did all the search criteria and everything. We got the literature what we want, and then there was a WHO action plan. And then what we did was that we placed this literature into various action plans. So our conclusion was that in action plan, for example, 2 and 3, majority of the Irish literature is in action plan 2 and 3, whereas 7 and 6 does not have much. So we are not doing an analysis, but rather we are just explaining the lay of the literature with a particular framework. Systematic review, as I said before, it goes a bit more into detail, saying that, okay, the evidence indicates that intervention A is better than intervention B for disease Y. So it's much more of an advanced synthesis. I'm sure there are many other topics we can discuss within the differences, but I thought this might give an initial idea of what it might be, the differences and similarities. Questions? All right. I hope I haven't lost you guys yet. If you want to know more about, there are like 14 different review types, which I didn't know actually existed, but I learned this like in 2016. If you're interested more about different types of literature reviews and so on, you can read this article. I'm not going to discuss it much further, but it's a good article just to get an understanding of why and how and when we use different kinds of reviews. Now, just going to give a brief overview of scoping review steps. And I think Melissa and Tanatsu and others would actually explain it further. So these are the various steps. You identify a research question, and ideally you would do a literature review before that, and then you have a research question. You identify relevant studies. And remember, this is where scoping review is a bit more flexible than systematic. You decide, should I reach out to ministries? Should I reach out to some authorities? For example, some of the reviews we did for WHO, of course, we reached out to ministries, but we didn't get much. So then we actually went to the ministry's website in various countries and looked up, and they have a search tab, and we searched our keyword there in those sites. So this was not Web of Science, this was not Scopus, but this was the individual Minister of Health website, say in Jordan, for example. So these are the various ways how we can identify relevant studies. So not just through the typical academic databases. Study selection. So ideally what happens is that you do these searches and you create a reference list using Zotero or EndNote or whatever tool you have. And then you start to see, like, okay, is this relevant? Is this not relevant? So regardless of how good you define your search strategies and keywords, you will still have a lot of irrelevant studies. I think when we did the Irish review, I think we had around, I don't remember now, maybe around 8,000 articles, and we ended up selecting maybe 200, 300, something like that. Because some of the things will be just commentary. Some of might be like migration of birds, because there is migration, there is health, right? Even if I select humans as subjects, other things come into play. So here I just want to give a tips on this particular tool. This is not my tool. I'm not paid to do any promotion. Right now, some of my students are doing this review, and actually they're using this tool, Ryan. It makes the selection process a bit more easy. It's partially powered by AI, and there is free version, and you can invite many people to come and collaborate. It's quite fast. You can give it a try. Once more, please.
I just wanted to check if there is, maybe that's not going to be answerable, but if there is a standard number of articles that you, when you're conducting a scoping review, some kind of expected to have as the final articles that you will then kind of say these are the findings after all the, what you call it, the
No.
streaming and everything.
Absolutely
Is there a specific number?
Absolutely not. And that is exactly why I do scoping review, because we don't know what is out there. So absolutely there is no limit on high or low limit. I mean, I've been part of studies where you had like probably 10,000 articles or references you download, and maybe you end up having only 10 that is relevant. It also depends on how broad and small or narrow your research question is. So systematic reviews, you often end up with very small number of articles because it's too narrow. Scope reviews tend to have a bit more higher, and absolutely there is no number. So those of you who are working with scoping reviews, try using Ryan. It's a bit easier. At least it felt easier for me. You can also collaborate on the same database with many colleagues. So let's say you have 1,000 hits. and you're 4 of you guys. So each of you are gonna take 2,500 each, which is still a lot of number. But then you all can work on the same database, and each and everyone can see who is doing what and all those kind of things. Then you can add tags and names and comments and everything. So try it out if you have time. And then data charting, I'll show you later. An example I'm doing right now for WHO, what kind of data you want to extract. And this also depends on what is the idea you want to give. For you remember, when I did my lecture on Tuesday, I showed you a pie chart showing that 31% of the global literature on migration health is on refugees. I was able to produce that pie chart because of the data chart I created when I did the scoping review. I can show you how I did it later on. And then finally, you collate and summarize reporting results. Here, between 4 and 5, or actually 3 and 4, depending on the setup you have, if possible, also do the appraisal of the document. For the Irish one, what we did was that we did appraise the document, meaning was it good quality, low quality based on the tools we used. But we did not exclude because it was of low quality. We included the low quality one, but then we added a comment saying that X number of documents were of low quality because of unclear results, unclear target groups, and so on and so on. But we included that. As I said before, there are studies who completely exclude because it's of poor quality. That's between you and how you have your project. Population group here. And then we have the area, the topic we are interested in. This is for scoping review. And then the geographical area. For example, this is something we are doing for the WHO European region. So we have listed the 53 countries in the region. Note, for example, for Finland, we write Finland or Finnish. So there could be article done in Finland, but they never use the word Finland, rather they say the Finnish population. Same for France, French, and so on and so on. If you're doing a global review, of course, you don't need this. And depending on, and if you're doing a particular disease, then you need to write that, but also think how you can actually, how these words could be used differently. For the example of migrant. You guys, I assume you all are familiar with Medline. So there is a way how you can, so there is a thing known as mesh terms. So when you go to Medline and type in a keyword, for example, health or cold or antimicrobial resistance, you type in the word, often, I don't know exactly where it's now, probably on your right-hand side on the lower corner, there is a small box called mesh terms. What it does is that it will show you all the different variations and how the word microbial resistance, for example, has been used in various articles. So then you know what are the different forms you should have in a search strategy. The same thing goes for M-based database. There, I think they call the M tree and so on and so on. So always think what are the ways people might, the researchers might use it for. This is a simple version of it, but if you want to use a bit more complicated version, there are various ways how we call it. It's called, for example, one is called PICO strategy. It's basically P stands for the population or the patient group. In this, it's the migrants. The I stands for the intervention or the exposure. In this case, it's health. In other case, it could be malaria. It could be work insurance. It could be anything you want. C stands for the comparison group. Are you going to compare with the host population? Because then it's a different kind of review. Here, we are not doing any comparison per se. So the C part is not relevant. And O is the outcome. Are you looking into mortality? How many are more
Soorej,
dead? Yeah.
Are you moving your slide or you're still on the six
No.
things?
I'm just saying, no, I'm not moving a slide.
Okay,
I didn't
sorry.
add it because it's getting a bit more complicated. I didn't want to do it, but just want to show that there is also other strategies called PICO and a lot of others. And I don't think you need to know that for the scoping review part of it. This was my last slide, but I'll show you the extraction sheet and then I'm done. Let me see if I have it. Yes. You guys should be able to see an Excel, right?
Yes, we can see it.
Great. So this is one of the sheets we use for the WHO scoping review. So this is a typical data extraction sheet. So then I put the name of the author, where the study was done, because this was for the European region. So, for example, the conclusion could be that you also remember when I did my first lecture on Tuesday, I showed you a map, and that was not created based on this. But I can do the same thing here, saying that majority of the studies on migrant health seems to have done in Germany. I could do it because I'm extracting that particular country information. So again, there might be studies which doesn't say Germany, but it might say German. So meaning it is done in Germany. So on and so on. When it was published, what kind of study was it? These have to be predefined, otherwise your life will be a bit more messy. So you need to say which other studies I can include. Should I include observation study? Should I include cross-sectional, longitudinal, cohort? Should I include qualitative, not qualitative, and so on and so on? Should I include randomized controlled trials and so on? Then which migrant groups? Some places it's clear, some places it's not clear at all. They just say migrants, then we call not specified. What kind of health issue, as in health outcomes, not determinants, but health issues. We put section on main results. This, for example, if you generate a word cloud based on what is over here, you get an idea of what are the main words, what are the things they're saying, higher mortality, lower mortality, and this and that, and so on. And if it's on health status, again, similar to this one, bit more clearer, specific. If it's health system, are we looking to financing, service utilization, governance, and so on? And then are we looking to health determinants, then food and nutrition or work influence for education and so on. So this is one example. And it was based, for example, it was based on this column. We could generate the pie chart saying that 31% of the global literature was just on refugees, and another 33 was on not specified group. All right, I stop here. More than happy to take any questions, if you have any. I see a few questions on chat. Persuade, yes. Why we're doing it? Clear, good. Both will, I think, we will discuss. Charity had a question on which part of an article must we focus on when we review literature. I think the extraction sheet gave you an answer to that, depending on the question. If you just want to know where the study is conducted or which groups are studied, maybe it's enough to look at the methodology. But usually you don't focus on a particular part of an article. You take all of it and then you have an extraction sheet. And the extraction sheet is often created based on the research project or the research idea you have, so that you get those data. And then Charity, it's a long comment. Do you wanna speak up, if possible? Okay. No, it was not a question. It's rather a comment. Okay, I read it. Good. Questions from anybody? The extraction sheet. Yeah, sure. I can share it without the data. Yeah, I can. Yes, Joe, please ask me a question, Joe. No worries. Thank you. The floor is yours.
Soorej, I wanted to hear from you. When you're reading, so I've got some issues with
You're mute now.
internet, so I'm
went on mute.
between
Yeah.
I'm between my phone and
Yeah.
my laptop. Sorry. So the question is, when you're reading a scoping review or a systematic review that's been published, what for you, or if you were sent one to review for a journal, what for you would convince you of the quality and publishability, as it were, of that review article? What would you look for? What would make you trust what had been was being published or put into the manuscript?
It's I'll first look into the search strategy, because I've had reviews where I reviewed reviews where they won't say migrant health and they only use the word migrant and refugee, and they felt that they covered everything. And as I showed before, there are many different ways how migrants are being referred to. If you don't have an comprehensive search string, I would think that is of a poor quality. And then also the databases they looked into, if they just looked into one, and I think, we all have to be practical, and if you don't have time and everything, it's fine. But then they have to be explicit about it and then state as a limitation. We only looked into, so right now, I'm developing a research agenda for a particular organization, and I don't have much time. Of course, I would like to do a review covering all of it. I can't. So what I did was that I use search strings in 4 different main search engines, and I picked the hits from the search engine that gave me the highest number of hits. So then I at least have a justification saying that there are other search engines which could have been included, but due to lack of X, Y, Z, I'm not doing it. But I'm taking the search engine that gave me the highest number of hits, assuming that it contains most of the literature. The other thing I look into is also how they analyze and how they conclude. Because often we, as human beings, have a tendency to conclude more than actually what we should. But primarily it will be the search strategy and the inclusion exclusion criteria.
Thank you, Soorej. The reason I mentioned that is I think it's important for everyone to, as Soorej was saying, right, there's different kinds of reviews, and you're not going to get something you claim to be a scoping review or you claim to be a systematic review published if it's not one of those things and if it hasn't been done rigorously. And I think sometimes there's a tendency, we say, you might write in your proposal or something, oh, I did a systematic review of the literature. But that's not actually what you meant. What you meant is you reviewed the literature. Perhaps you were quite organized in how you did it, but that's not the same as doing a systematic review. The same as scoping reviews. I think yesterday, once more, was it you, I think, who was, I don't know if it was yesterday, sorry, but was talking about, trying to get a scoping review published. And it's true, they're not always the easiest things to get published because the expectation in terms of the level of rigor is high. I was quite surprised a year or so ago when it's what I'll share in a bit, but the number of kind of review articles that were coming up in my scoping review. And when I looked at them, they were these terrible sort of extended literature reviews, sort of commentaries published in poor quality journals. But you see the word review, got a quick win on reading some good literature, right? We always go for the review articles, right, when we're looking at certain topics. But it's just a warning to not fall into the trap of thinking because someone's calling it a scoping review, that actually that's the work that's gone into it. And that's one of the reasons that I think it can sometimes be frustrating and tricky to get a scoping review published, because if the reviewers are not convinced by the rigor, that won't ever get published. So I just wanted to flag that. Thanks, Soorej.
Thank you. And I just want to add that you need to have a methodology behind your approach. So when on the slide I showed you various steps of scoping reviews, there is a reference down there. And that is the methodology article I followed, just like how you do a thematic analysis or a grounded theory, for example. There are methodology articles on how to do defining each and every step. So always, refer to that. This is the rigor method. And again, think about this. Sorry, I have a bias. I come from the medical background, medical faculty. It's always a reproducibility so that it's nothing by chance. When you say that you have followed this step by step by step, then meaning that anybody else following the same step you have done should be able to get the same results, meaning it's not by chance, it's less subjective. That's an argument. We all are subjective, as we said before, but have a clear methodology and steps on how you do your reviews. Thank you. Yes, Persuade.
Thank you for your presentation. I just want to ask, when you are searching the databases, when you are using different databases for your scoping review, so I wanted to ask, is there, like, you have selected the databases that you're going to use, that you're going to search into. So is there still a need to run your search words on Google Scholar, or usually, because Google Scholar is a platform, right? So now, is there still need for you to run it on Google Scholar, or searching in the databases is enough?
Sorry, I cannot give an yes or no answer. The answer would be depends.
Okay.
Depends on what's the time and resource you have. Google Scholar, it's actually a good source. It captures a lot of info and a lot of other kinds of things, but it's not as systematic as you would do in PubMed or other things, because Google captures it from pretty much anywhere around the world. If it's on the web, it's usually going to end up there. But if you go to certain journals now, they clearly say that this journal is indexed in PubMed, indexed in Scopus, and so on, meaning anything from that journal automatically get transferred. So it also means that Scopus does not take stuff from anywhere across the web. So there is an assumption, to a great extent, it's also accurate. There is some sort of quality check in this thing. But as I said before, especially if you're doing a scoping review, you might miss on WHO reports or other reports if you're just depending on Scopus or PubMed, whereas Google Scholar will pick it up. One more thing when you do literature search is that, of course, you do a search and you get the articles. You select, let's say, you had 1,000 hits, 10,000 hits, and you end up having 1,000. And then you find certain articles which are key articles. In scoping review, what you also do is that searching through the reference of the key articles. So take any topic you get and you have a key article, then you actually look through the reference list of that article and see, did I miss anything in my search strategy that came up over here? So then you can also pick articles from the reference list of the key articles as well. So all this kind of flexibility exists in this kind of search. Another one we do is we also have consultations with key researchers, key people and authorities saying that we are doing this review. Are there any key documents that we should be aware of that we can include? People often don't do that in systematic review because the idea is that systematic review, we are only going to look into what is published in high quality peer review journal, meeting our inclusion criteria, then we analyze it. Scoping review is a bit more broader, just to get an understanding about the topic, a broad understanding. I hope you answered the question, Pursuit.
Yes, I am answered. Then the other question that I wanted to ask is the Ryan, is it also the same as confidence? Like, does it do the same thing when
What is
selecting
confidence?
confidence? Is what can I say? It's also an application that you upload your articles that you want to do data extraction in. So I wanted to ask if it is
Ryan doesn't do any data extraction. It only makes it so even if it's called AI, it doesn't do anything for you in that part. It's just making the selection and removal and adding much more easier. Perfect.
Okay.
We will talk about confidence. Yes.
All right. Thank you.
Great. I think I'm done, Joe. The floor.